So what are my recommendations after I've injected a dog with Arthramid Vet? Right? I sent them home that day. I want to keep them on their existing pain medications. We know with Arthramid Vet that it's going to stay in the joint space for about 4 weeks until it moves into the synovium and integrates completely. That's from a recent research paper in horses. So we know in the first 4 weeks that the joint's starting to feel better maybe, but it's going to take a while for that synovial integration. So in my mind then, I want to keep that dog on its NSAID, its other things. And then I'll recheck that dog at 4 weeks and go, how do you feel? Are we starting to move a little bit better? And then maybe during that time, the next 1 month or 2 months, can we then start to perhaps reduce some of those systemic medications? That's the reduction phase. What do we do about the productive phase, right? So when I send them home, we say, okay, like with any joint injection, they may be sore for a couple of days. So we're going to keep them on their meds, and we encourage owners to use an ice pack over that injected joint. And I want them restricted somewhat. Right? That means to me, I don't want them out running off leash in the yard. Right? I want them controlled exercise. And families kind of forget, right? We think that we have to run long distances, we have to run super fast to be exercising. Right? These worn out, really arthritic joints, standing is hard. Walking is hard. So we want to get them moving again. Right? A body in motion stays in motion. So they go home, go for a walk the next day. Go for a short walk. You can just take a couple of laps around the yard, but do that under controlled fashion. Get out, spend a little bit of time with them. Right? Let them, they need a chance to, of course, eliminate, right? But go for 5 minutes. Right? I just don't want them playing hard, high impact things. Tug of war, fetch, things like that I'm avoiding for a while. So I really want them to be out and moving. And then after a couple of days, we add a little bit more. But I'm keeping them probably in 10 to 15 minute walks once to twice a day for the first couple of weeks. This is also patient dependent as well. Right? If we've intervened early, which we like to do, right? I'm still going to avoid those heavy activities, but if that dog's already was walking 30 minutes, what was painful in the last 5 or 10, that dog the next couple of days later after sedation could easily walk 15 minutes 3 times a day. We're just not hitting that point where they were sore and painful before, but I want to keep them moving. And then as we hit our waypoints, we recheck them at a month later and maybe 2 months later. Now we're adding on more activities. We're also then asking them to just do some other simple exercises along the way. In the house, well, it depends on what that home environment is. I really don't want them in a crate. I want them to have a chance to get up and stretch and do the things they need to do. If their behavior requires them to be in a crate, or their home environment already requires them to be in a crate, okay. But I want them to have a chance to get up and stretch, to move. But I'm really avoiding those high impact activities while we allow the Arthramid Vet gel to do its job, to get from the joint space into that synovium to help improve that joint for the long haul.